First, the Lutheran Church in Liberia is one of the oldest churches, little over 150 years now. But the HIV program was established in 2001 because, you know, when HIV first started, the Lutheran Church was one of those churches among the many that was not playing any active role in the response to HIV. So at one of our conventions in Phebe, County, that is in central Liberia, the Lutheran Church was mandated by the convention to get more involved with HIV and AIDS activities. So the program was established officially in 2001 with a specific goal to contribute to that of the National AIDS and STIs Control Program of Liberia. And that goal is to mitigate the impact of HIV and AIDS in the country. We're involved with training of counselors, we train media practitioners, we train health workers, we train pastors. We lay more emphasis on youth and women. And in fact, we have support groups of women. These are groups that are made up of social women. We've also worked in the area of orphans and vulnerable care, children. So we provide OVC services to those OVCs that have been identified. We work with ZOs. These are the custodians of our heritage in Liberia, very important traditional people. We've been able to take our own activities across to them, and it's really interesting in working with these traditional people. We also work with people themselves who are living with the virus. We've been able to establish a little over 11 different support groups of people living with the virus, comprising of a little over 350 members. So these people are encouraged to go public through the counseling they receive from our centers. We're doing a great deal of work back there in Liberia, and we have 15 political subdivisions in Liberia, but our program is currently working in 9 of those counties with sponsorship from the Lutheran World Federation and the Danish Mission Council Development Department, that is DMCDD. So those are some of the things that we are doing back home in Liberia. And that was what I was so impressed when the session on family planning was mentioned by CCIH. I was part of that session this morning. It's really interesting, and I think we're going to be looking in that direction because it's also good. It will help to plan the families, and then that could also is also another means of preventing the spread of HIV when people have not planned to enter into sexual relationship at the time. My involvement with this work is so interesting. I got involved out of fear. When I heard about HIV newly, I was so afraid. I did not want to do my HIV test. I was one of those people in the denial of HIV. I was saying just to comfort myself that something must have to kill somebody, so I'm not going to take HIV test, and nobody tells me about HIV and I listen to it. But when I had the opportunity to be trained, I went through 6 weeks of intensive HIV training, and that training opened my eyes. And I started to regret those days when I refused to go for HIV tests and even believe the existence of HIV. That was long ago, 2004. So after that training, I decided to get involved to also help those that would be in the same position that I was in before that training. I started this work as a volunteer counselor. I used to go in the field creating what we call community outreach, just create awareness about HIV and AIDS in the marketplaces, in the schools and hospitals. And then later on, I got employed as a counselor, where I was assigned at one of the major referral hospitals in the country, that is the Phebe Hospital in Bon County. As a counselor, I counseled a lot of people, I tested a lot of people, and I established a lot of support groups. And then I left from the counseling field and went to become a trainer, where I had to go to do advanced training to be able to produce counselors who play a major role in the prevention and control of HIV. Today I'm in programming because I work as a program officer, making sure that we deliver our, we will be able to achieve our objectives according to our own time frame.
Well, thank you for your time, Phebe.
Well, I appreciate everything, especially CCIH. I'm grateful to this organization because it has provided us the opportunity to be able to share some of our own experiences in Liberia. And more besides, it has also afforded us the opportunity to learn a great deal from other organizations around the world. Like the 2 days I've stayed here, I listened to all of the presentations, and they have inspired me so very much. It makes me feel that, hey, you're not alone in this work, and you need to keep up. Though we've done so much, but with all that I've listened to, I feel we need to do more. So it really challenged me when I listen to these, to other people, work that they do. Thank you so very much. I'm honored by that.